Hi everyone, today is on Monday. Welcome to the channel. Here we discuss about medical issues and what is going on around our bodies. Now today, the topic of today as per uh, our title is types of arthritis. What is arthritis? Someone may ask that question and you may fail to answer. Arthritis mostly is inflammation. But you see, inflammatory diseases and inflammation, let's talk about inflammation. Inflammation is a very a discussed word. It is discussed everywhere. Every time someone tells you, I've got inflammation, you should understand what is inflammation. You see, what is inflammatory disease and what is inflammation? Very important. What is inflammation? Just a minute, I send this to, yes, what is inflammation and what is inflammatory disease? What is inflammation and what is inflammatory diseases? Inflammation is the body natural protective response to injury, infection, or harmful substances. You understand that its purpose is to remove the cause of harm and start a healing inflammation. And it comes out with five signs of inflammation. You put your hands like this and then you remember inflammation, the natural response of a body to injury and infection. So the first one, let's say when you are, let's take an injury like a blunt substance have hit you. So the first thing you will get is swelling. Fluid leak into tissues causing swelling. And then when swelling happens, there is heat, warmth. You see, when you are swollen somewhere and then you, yes, yes, let's continue. Yes, the network has come. Now, it is when you touch someone somewhere, it is warm. You get it? That is heat, warmness. And then there is pain. Chemical release irritates the nerve endings. So where it's a swelling, the chemicals of inflammation mediating the inflammation, they cause you to feel pain. You get it? Because they release some chemicals, irritates. We will go one day to see which chemicals are these. And then redness. When you are struck by something blunt and you have a swelling, you will always get redness there because of increase in blood flow around that place. So, and loss of function, of course, if it is your arm, it will not locomote or it will not move, loss of function. So the inflammation we have said, it is in a natural protective response of infection or harmful substances to some places. So before you know what is arthritis, you really need to know what is inflammation. You get it? Because inflammation is the basic thing when it comes to arthritis. So let's continue. We have said inflammation is the basic when it comes to arthritis, but the signs of inflammation, we have said there are how many? Four. Redness, heat, swelling, pain, and loss of function. So let's get down to types of arthritis. What are the types of arthritis and how do these types of arthritis come? But today, remember, a short session, and we are talking about how arthritis come around and the types. So we get to types of arthritis, very important when we are talking about arthritis, because sometimes you may not come out to be arthritis positive, but the doctor is telling you this is arthritis. They have taken your blood, they have taken to the laboratory, it is negative on rheumatic arthritis, and then the doctor is still telling you you have arthritis. Let's see types of arthritis. We have osteoarthritis. Osteoarthritis. How is osteoarthritis? Osteoarthritis is caused by wear and tear. Yes, wear and tear. Most common type affects the knees, hips, hands, and spine. Get it? Hips, hands, and spine. wear and tear. When your bones are weak, maybe low calcium, or you have a genetic problem, you get osteoarthritis. And then we go to the other type. The main types of arthritis are osteoarthritis, and rheumatoid arthritis, of course, psoriatic arthritis, psoriasis. When you listen, you think of psoriasis, always think about the skin and some issues of the skin that may get inside you. We have something, a very complicated word, but it's not a complicated word. It's just a medical term. Bibishosh. Hey, Benjamin the Wise. Yes, Bibishosh, welcome to the channel. We're talking about arthritis. Now, you continue to talk about arthritis. So if you have anything about arthritis, it's associated, you just ask. We are here talking about the other one, which is called ankylosing spondylitis. Ankylosing spondylitis. There is a student who told me this word is very complicated. We will see it's not a complicated word, it's just a type of arthritis. But we remember from the beginning, we have said arthritis is inflammation. Inflammation is three, by redness, swelling, but it is a process that is helping you to heal the body. And then we have the last one, which is gout arthritis. Now, osteoarthritis, we have said, it is caused by wear and tear of your joints. Imagine your bone of joints and your density of the bone is low because of calcium. So they rub against each other and then they wear. Then you lose balance and then you feel pain because you have continuous wearing of the bones. Your bones are cracking and the density is low. So you continue having inflammation. And you remember inflammation comes with pain, swelling, redness, you imagine. So between the joints, the mostly affected are knees, hip joints, mostly in women hip joints because their pelvic bone is big than the men. And then we have hands, the joints of the hands, and spine, the spine. And then we have rheumatoid arthritis. Now, rheumatoid arthritis, this is a genetic factor. When you go to, we take your blood to the laboratory, and then we take the rheumatic factor. If it is positive, your genetic line, you have it. It may not be causing symptoms like pain and sort, but you are positive on rheumatoid factor. Autoimmune, it is called autoimmune disease. When I'm saying autoimmune means some cells of your body fighting against some other cells of your body. So they mistakenly, like the soldiers of a country, mistakenly fighting their own soldiers, but they are supposed to be guarding the country. So the cells of our bodies are guarding our bodies, and this is the country. So some cells of our bodies, they are fighting against the other mistakenly. So that is what we call autoimmunity. Autoimmunity. Automatically your cells start fighting the other ones. And when you have rheumatoid factor in your family genetic line, this mostly happens. You get it? Immune system attacks joints. You get some of your immune system, they just start fighting the joints, the cells of the joints. You start swelling anyhow. You get it? This is called autoimmune. Swelling, pain, and stiffness. Because now we have said inflammation comes with swelling, pain, redness. You get it? So the joints of and this one I can tell you for free. We can only reduce the inflammation and the symptoms, but we cannot make you to be rheumatoid arthritis negative. No. We only treat the symptoms. And at times it can affect your organs. Today I'm just going through types of arthritis, but when we come after arthritis, we will be taking one specifically as we go. Now we go to psoriatic arthritis, occurs in people with psoriasis. Psoriasis is a disease of the skin. At times you just feel like peeling and scratching yourself. You get it? And this may get to your joints, your eyes, you removing tears every time. And sometimes you get on your joints, you have chronic lesions. You get chronic lesions. Lesions are wounds that come and go. They are not healing fast and they are not going. Skin lesions, on your skin, you have some wounds. Now, the other one that someone was telling me, this one is a complicated one. No, come on, this is not a complicated word. It's just something to explain something. Ankylosing spondylitis mainly affects the spine. The spine. You have seen someone going like this on the side, like this while walking. This person may be having ankylosing spondylitis, and it comes gradual. It affects the spine. Remember, today I'm just mentioning about the types of arthritis. The spine has cartilages, and when they are eaten or they are destroyed by some factors, your spine may go like this. So your curvature, you are supposed to be straight like this, but your curvature will come like this. So this is called ankylosing spondylitis. Let me just mention the other topics will come. We will go one by one, mentioning how osteoarthritis can come. You get it? And then we have gout arthritis. Erica XC, hello Benjamin, come in. Welcome to the channel. Today we are going through types of arthritis. And remember, Erica and anyone who is watching, if you have a question, raise it. If we can discuss now, well. If it is later, we can discuss later. Now, Erica, welcome. Me welcome Erica to the channel. Erica. Now we continue ankylosing gout arthritis. This one affects those people. You remember them? Those people, kinywaji kidogo, alcohol, meat. It starts, the definitive feature of gout arthritis is the big toe. Your limbs swell, but the big toe of your foot is always pain and heat always. Yeah? Uric acid elevation is the culprit here. Uric acid crystal buildup is the culprit here. We will see how uric acid builds up and destroys your body. Yes, often affects the big toe. Classical feature, if you have a friend and at times he complains of the big toe, just know this is gout. Mostly if your friend or your relative or a person who is complaining, he likes eating meat and drinking alcohol. Yes, that one. It is very sudden and becomes severe. Even some people cannot walk well. You get it? So let's talk about other types of arthritis. I've just gone through the main one: osteoarthritis, rheumatoid arthritis, psoriatic arthritis, which are the skin, ankylosing spondylitis, which is the spine, and gout arthritis, which is uric produced. Now, other types of arthritis, we may go like juvenile idiopathic arthritis, which occurs in children, joint swelling and stiffness. And when it comes to juvenile arthritis, which is idiopathic, which means we don't know where it comes from children, this may be a factor of genetic makeup. You get it? We will discuss it and know how juvenile arthritis comes. We have reactive arthritis. Reactive. You see, we have juvenile, but other comes in, we have reactive arthritis, developed after an infection. You get a boil. Everyone knows a boil, accumulation of pus. That pus is called Streptococcus pyogenes, and it's a bacteria. So it starts to give you some arthritis, some features of arthritis. This is called reactive arthritis. Mostly affects the joints, eyes, and the urinary tract, because if you get a boil and you have a bacteria, it can go to the kidney, it goes down to your blood, and then it comes out as UTI. We will go, when time comes, we'll go on and see how reactive arthritis is. We have septic arthritis, sepsis. Every time, thank you so much, Benjamin. I have the benefit of your advice. They say I have rheumatoid arthritis and arthritis. I have the problem to cope with when it's winter. Yes, baby Shosh, if you have rheumatoid arthritis, they must have done something called rheumatic factor, and they from your blood, and they found out that it is positive. So when they found out it's positive, they said in your family line you have that it may not be your mother or father or something, but your genetic line, there is someone who carried this gene. You get it? And then osteoarthritis. Osteo, we have seen it comes to bone. You must be very careful when it comes to eating, when it comes to calcium balance, because if you do a lot of calcium, it can be a problem. If you do low calcium, it can be a problem. And I advise you do something called parathyroid gland hormone levels, the one that balances the calciums. It is very important when you are diagnosed with the two, rheumatoid arthritis and osteoarthritis, you check the level of parathyroid hormone. It may be the problem, and they are thinking it is only rheumatoid. So when you balance the parathyroid hormone, all this problem goes. I've seen such cases in my practice, and they are very common. So, Bishosh, if you have not done the parathyroid hormone, make a date with your doctor. Request your doctor for that. You may be helping your doctor to help you. Yes, let's continue. I think that one is okay. But when we will come to the osteoarthritis and rheumatoid arthritis, I think we'll go through and it will be your help. Today, we are just going through the types of arthritis as we go. And if anyone has a question about arthritis, please bring it up. I'll answer, and we can discuss to get help. We usually help each other to grow. Now we continue. We have said septic arthritis. It involves something that causes you to have an infection, and it goes an infection mostly of bacteria. Welcome, baby Shosh. Yes, welcome. An infection that comes out with features of arthritis. And then we have something called lupus arthritis. Lupus, linked to lupus. It is called systemic lupus erythematosus. Hey, very complicated word, my friend. It's not complicated. SLE. Joint pain, other organs, and involvement. It involves organs. Imagine you have features of arthritis, but other organs are being affected. We will see which organs are being affected here. Please, if you're here listening and you're going through all these, I started with arthritis. Yes, good. Yes. Please like the video, ask your question. If you have, you can give an overview of yourself, like Bishosh. It's very okay. You may be helping some other person on what the person is going through. So please, let's help each other to help each other. If you have an experience of something that I'm talking about, bring it up, and we may come to an understanding, because when it comes to medical issues, even as we are growing in and getting more experience as we practice. So your word may be helpful to me. Now we have said lupus arthritis. Those ones are linked to SLE, which is systemic lupus erythematosus. We will discuss it. And then we have enteropathic arthritis. Anytime you hear enteropathic, think of the digestive system. The digestive system, it comes out with something called ulcerative colitis, ulcers in your stomach. You see, arthritis can get into your stomach. Now we know. Here we have enteropathic arthritis, entero in your stomach, and there are two. It comes out as occurs with Crohn's disease, patches of ulcers in your stomach, mostly the large intestine. Ulcers is just a common name to call wounds. It's not complicated. We have here, and then we have ulcerative colitis. We will see when we are discussing this, what is the difference between what is the difference between enteropathic arthritis and systemic lupus erythematosus, and then there is another difference called Crohn's disease and ulcerative colitis. There is a big difference between those two, Crohn's disease and ulcerative colitis. So now you know You may be suffering from stomach issues every time seeing a doctor, They're being diagnosed with H. pylori and ulceration. And in another way, you are suffering from enteropathic ulcerations, which is arthritis. So it is very important when we come here, we will discuss the difference between H. pylori ulcerations and enteropathic arthritis, which affects the stomach. Many people out here go to a doctor office, hospitals, and clinics being diagnosed with H. pylori every time, given the kits of H. pylori or amoebas, and the ulcerations occur, and in turn, this person is suffering from this arthritis. Because it's not common, maybe the doctor who is seeing you is overriding. Getting a diagnosis is very complicated at times when symptoms are liking each other or likely spotting this. You get it? And then we have the last one here, we call enteropathic arthritis, occurs in Crohn's disease. This is the very important feature when it comes to your problems in your stomach, because you may be treating amoebas for so long, you may be treating H. pylori for so long, and you are not getting well, and in turns you are suffering from Crohn's disease or ulcerative colitis, which is arthritis. The mode of treatment of these problems are different. You get it? Those H. pyloris and amoebas, we give them antibiotics and antiprotozoals. But you see here, we don't give that one unless manifested by some infections. You get it? So as I finish, I may say there are several types of inflammation when it comes to arthritis: acute inflammation and chronic inflammation. We have said what inflammation is. Please, if you've not seen, you start it from the beginning. The acute inflammation is short term, like cut, infection, and spray. And then we have chronic infection, long term. Every time you are getting swelling, and it can damage the tissues. You get it? And then we have what is important in inflammation is this, and mark it. When you see you have arthritis and you're selling, your body is telling you, let me protect your body from more wear and tear, and you are getting pain. You get it? And it is constantly healing itself. There are some types of arthritis that we cannot treat, and there are some types of arthritis that we can treat. So something like rheumatoid arthritis and your genetic makeup, you have it is positive. I will say that one, if your doctor tells you that it is treated, it's okay. I will tell your doctor, please let me find out how we can treat it, and you get the technology of treatment so that we can do what? We can treat it. So we check and we see how you can treat the arthritis. Like you see, the experience that we've had right now, Bishosh has told that she has rheumatoid arthritis and osteoarthritis. I'm very sure, yes, there is no definitive treatment. Dorothy, yes, you find another phone. You find a definitive treatment. Just a minute. Sorry about that interruption, guys. Yes, I'm sorry for the interruption. Yes, I was saying you find another, if a doctor said he can treat this type, I really need to find the new technology that this person will use to treat you. Thank you so much for all that have been in the platform. I think we have done a lot on arthritis, the type of arthritis. Next time we'll start defining one, and as we continue. Share, share the video. You may help someone else. And if you have a question for someone else, just ask. My email is always tagged. It's benjaokwesh@yahoo.com. Let me type it there. benjaokwesh@yahoo.com. Have a lovely evening, and everyone be blessed.